have you ever caught a glimpse of your reflection and thought, wait, when did that brown spot get there? Well, whether it's on your cheek, chest, or the back of your hand, these marks seem to show up out of nowhere. And most of the time, we're told that they're just a normal part of aging. But what if your skin is trying to tell you something deeper? In today's video, we will talk about why we get brown spots from both conventional medicine and functional medicine perspectives, and what they might mean for your overall health. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So what are those brown spots really? Well, let's start with the basics. So brown spots, also called age spots, liver spots, or sunspots. They're flat, tan to dark brown patches that show up on your skin, especially in areas that get the most sun: the face, chest, shoulders, forearms, and hands. They often start appearing in your 40s or 50s, but can show up earlier depending on your sun exposure, genetics, or skin type. And they're usually harmless, but for many people, they're very frustrating because they make the skin appear uneven or older. The medical name for a brown spot is solar lentigo. Solar for the sun and lentigo meaning a spot. And they're exactly that. They're evidence of accumulated sun exposure over time. So let's look at the conventional medicine perspective on brown spots. In traditional dermatology, brown spots are simply seen as a skin issue caused by sun damage. And every time you step into the sun without protection, your skin cells activate melanin, a skin pigment, as a defense mechanism. Melanin absorbs UV radiation and prevents deeper damage. But when this process happens repeatedly, some pigment-producing cells go into overdrive. So they start producing melanin unevenly, leaving behind clusters of pigment that don't fade away. And over time, these clusters become visible, flat, brown marks that don't tan or peel away. And they're more common, and I'll repeat it again, on these sun-exposed areas: face, chest, shoulders, forearms, and hands. They're not dangerous, but they can grow in number and size. And again, many people just find them unsightly. Sometimes other factors like medications and certain antibiotics, NSAIDs, chemotherapy drugs can make your skin more reactive to the sun and trigger these spots even faster. For example, doxycycline, a commonly prescribed antibiotic, is one of them, and it makes you more sensitive to the sun. There also is a different type of pigmentation called melasma, which shows up as diffuse patches often on the side of the cheeks or upper lip. Melasma is usually hormone-related and triggered by things like pregnancy or birth control, but it's a separate condition from classic sunspots. So what does conventional treatment for brown spots look like? First, there are topical creams that lighten pigment over time, and these include hydroquinone, retinoids, kojic acid, vitamin C, and azelaic acid. Some are prescription strengths and others are over-the-counter. Then there are in-office treatments like chemical peels, cryotherapy, IPL, intense pulse light, and laser therapy. And these work by either peeling off the top layers of skin or targeting pigment directly to break it up. And usually the way I approach this in our clinic is when somebody just has a few brown spots, then the easiest and the quickest treatment would be treating them with liquid nitrogen, which is called cryotherapy. If the whole area, such as face or hands, are hyperpigmented, meaning that they're covered with numerous brown spots, then I recommend IPL or laser. However, the most important part of treatment is prevention, and prevention is sun protection. Daily broad-spectrum sunscreen, not just in the summer, but year-round, is the cornerstone of prevention, and I will pin my video about the best sunscreen above. But of course, if you are curious, and you probably are since you're here with me on this channel, then you may have a question. What's going on underneath the surface? What really causes these brown spots? And that's where functional medicine comes in. So from a functional medicine point of view, your skin isn't just a surface. It's a mirror of what's happening inside the body. So if you are developing more brown spots than expected, or if they seem to come out of nowhere, We don't just ask, how do we lighten this? We ask, why is the skin reacting this way? One major root cause is oxidative stress. This happens when your body has more free radicals than it can neutralize with antioxidants. Free radicals can damage cells, including the ones in your skin, leading to accelerated aging and, you guessed it, hyperpigmentation. Think of oxidative stress as an internal sunburn that speeds up skin aging from the inside out. Another key factor is liver function. Your liver is responsible for detoxifying hormones, medications, environmental toxins, and more. So if it's overwhelmed or sluggish, your body can't process waste efficiently, and this can show up on your skin. A congested liver may contribute to uneven skin tone, dullness, and hyperpigmentation. And then, of course, there is your gut. An unhealthy gut, especially one with imbalances in bacteria, low stomach acid, or leaky gut, can increase inflammation throughout the body. And when your body is inflamed, your skin can't regenerate properly. You may notice that even small sun exposure leads to lasting pigment changes. We also look at nutrient status. Skin health depends heavily on antioxidants like glutathione, vitamin C, zinc, vitamin E, and B vitamins. Without them, your skin is less able to repair itself or respond to damage appropriately. So if you're deficient in these, your brown spots may appear faster and fade more slowly or never fade. So instead of just applying a cream, functional medicine asks, are your detox and antioxidant systems working properly? Is your gut inflamed or unbalanced? Are you getting the nutrients your skin needs to repair? What's happening inside that might be aging your skin outside? This deeper approach doesn't replace conventional treatments, it enhances them. It's actually the difference between repainting the wall or fixing the leak underneath the paint. So let me tell you about a patient, we'll call her Jane. She was in her early 50s and had a handful of stubborn brown spots on her cheeks and forearms. And she used high-end skincare, wore sunscreen daily, although she started later in life, and had already tried laser treatment. But the spots kept coming back and new ones appeared every summer. So when we ran functional tests, we found that her liver detox pathways were sluggish, her antioxidant levels were low, and her gut showed signs of imbalance. So she started a personalized protocol focused on gentle detox, nutrient repletion, and gut healing. And we didn't promise overnight results, we never do, but over several months, her skin began to brighten and the new spots stopped forming as fast and aggressively as they did in the past. Since she made all these lifestyle changes and she was on supplements that we personalized to her issues, she started having more energy, less aches and pains, and overall felt much better. And she said, it's like my skin finally caught up with how I feel inside. So if you are interested in exploring functional medicine, we usually recommend starting with the gut. Our gut intensive program is a 6-week plan that includes a consultation with me, advanced gut testing, a personalized treatment protocol based on your results, and 4 follow-up visits to guide your progress. The program is available to residents of Massachusetts, California, New Hampshire, and Vermont. And you can learn more by visiting our website at mindfulmedicalfunctionalclinic.com. And I always recommend scheduling a 15-minute free discovery call before getting started. It's a good practice in general, be it our clinic or another functional clinic, to meet the doctor before getting started and see if it's a good fit. The link to schedule the discovery call is in the description of this video. So in summary, brown spots aren't just cosmetic, they are a clue. For some people, yes, they could be just simply signs of the sun and of time. But for others, they may reflect deeper imbalances that deserve attention. And conventional dermatology offers great tools to treat pigmentation, but functional medicine goes further. It asks why your skin is changing and what you can do to support it from inside out. If you like skin and functional medicine topic, check out my book, The Clear Skin Diet, Unlocking the Secret Link Between Food Sensitivities and Skin Health. It's about how various food groups can affect your skin and cause variety of skin conditions by changing your gut microbiome, immune system, and hormones. It's available on Amazon and Barnes & Noble. The link is in the description. Thank you so much for watching. I'm looking forward to reading your comments. Until next time, bye-bye.